everyone. Today I'm going to discuss about Cushing syndrome. In 1932, American neurosurgeon Harvey Cushing described the clinical findings that provide the link between specific physical characteristics and a specific type of pituitary tumor. This pituitary disorder became known as Cushing syndrome. However, it later became clear that many patients with similar symptoms and signs did not have a pituitary tumor. Thus, the term Cushing syndrome has been modified to refer to all patients with classic symptoms and signs of the condition, regardless of the cause, while the term Cushing disease is restricted to patients in whom the symptoms and signs are caused by an adrenocorticotropic hormone or the ACTH-secreting pituitary tumor. Cushing syndrome is a disorder that occurs when your body makes too much of the hormone cortisol over a long period of time. Cortisol is sometimes called the stress hormone because it helps your body respond to stress. Cortisol is produced by two small glands on top of your kidneys called the adrenal glands. Cushing syndrome can either be outside and inside your body. It is termed as exogenous Cushing syndrome and endogenous Cushing syndrome. Exogenous Cushing syndrome can be developed if one individual is taking an oral corticosteroid medications in high doses over an extended period of time. It can also be developed by using injectable corticosteroids, inhaled steroid medicine taking for asthma, and steroid skin creams used for skin disorders such as eczema. Endogenous Cushing syndrome can be developed by your body's own overproduction of cortisol. This may occur from excess production by one or both adrenal glands or overproduction of the adrenocorticotropic hormone, which regulates cortisol production. Here are some examples that can cause endogenous Cushing syndrome. First is a pituitary gland tumor. A non-cancerous tumor of the pituitary gland, located at the base of the brain, produces an excess amount of ACTH, which in turn stimulates the adrenal glands to make more cortisol. Next, ACTH-secreting tumor. A tumor that develops in an organ that normally does not produce ACTH will begin to secrete this hormone in excess, resulting in Cushing syndrome. Last, familial Cushing syndrome. Rarely people inherit a tendency to develop tumors on one or more of their endocrine glands, affecting cortisol levels and causing Cushing syndrome. The hypothalamus is in the brain, and the pituitary gland sits just below it. The paraventricular nucleus of the hypothalamus releases corticotropin-releasing hormone, which stimulates the pituitary gland to release adrenocorticotropin. ACTH travels via the blood to the adrenal gland, where it stimulates the release of cortisol. Cortisol is secreted by the cortex of the adrenal gland from a region called zona fasciculata in response to ACTH. Cushing syndrome caused by treatment with corticosteroids is the most common form. A Danish study found an incidence of less than 1 case per million people per year. However, symptomatic microadenomas of the pituitary are found in about 1 in 6 individuals. People with Cushing syndrome have increased morbidity and mortality as compared to the general population. The most common cause of mortality in Cushing syndrome is cardiovascular events. People with Cushing syndrome have nearly 4 times increased cardiovascular mortality as compared to the general population. Signs and symptoms of Cushing syndrome can vary depending on the levels of excess cortisol. General is weight gain, slow healing of cuts, increased risk of infections, fatigue, glucose intolerance, psychological, depression, anxiety, irritability, loss of emotional control, cognitive difficulties, decreased libido, headache, moon face, buffalo hump, muscular weakness, vascular ischemia or worsened high blood pressure, bones, increased risk of fractures, skin, thinning, fragility, acne, excessive hairness or hirsutism, and striae. In female, regular or absent menstrual periods, and in males, erectile dysfunction. Diagnosis is based on your medical history, a physical exam, and lab tests. Your doctor may ask if you are taking glucocorticoids or have had injections and rule that out before ordering lab tests. Doctors may use urine, saliva, or blood tests to diagnose Cushing syndrome. Sometimes doctors run a follow-up test to find out if excess cortisol is caused by Cushing syndrome or has a different cause. 24-hour urinary free cortisol test. In this test, you will collect your urine over a 24-hour period. Your healthcare professional will send your urine sample to a lab test cortisol levels. Higher than normal cortisol levels suggest Cushing syndrome. Late night salivary cortisol test. This test measures the amount of cortisol in your saliva in the late evening. Normally, cortisol production drops just after you fall asleep. In Cushing syndrome, cortisol levels don't drop. You can collect your saliva sample at home and return it to your healthcare professional or send it to a lab for testing. Low-dose dexamethasone suppression test. You will take a low-dose dexamethasone, a type of glucocorticoids, usually around 11 p.m. A healthcare professional will draw your blood the following morning, usually around 8 a.m. Sometimes doctors use another type of LDDSC test in which you take dexamethasone every 6 hours for 48 hours. Your blood is drawn 6 hours after the last dose. Normally, cortisol levels in the blood drop after taking dexamethasone. Cortisol levels that don't drop suggest Cushing syndrome. When one of the first blood tests show that your body has too much cortisol, the doctor may order a follow-up test called dexamethasone corticotropin-releasing hormone. Dexamethasone CRH test shows whether excess cortisol is caused by Cushing syndrome or by something else. The test combines the LDDST and CRH stimulation test. CRH is a hormone made in the part of the brain called the hypothalamus. CRH tells the pituitary to make ACTH, which in turn tells the adrenal glands to make cortisol. When cortisol level rises enough, they turn off the CRH signal, so ACTH and cortisol level falls. You'll get a shot of CRH and take dexamethasone by mouth. Cortisol levels that are high just before the CRH shot rise during this test, suggest Cushing syndrome. Another tests are the high-dose dexamethasone suppression test, imaging test, blood test, petrosal sampling. Treatment of Cushing syndrome depends on the underlying cause of excess cortisol, but may perhaps include surgery, radiation, chemotherapy, or the use of cortisol inhibiting drugs. If the iatrogenic from long-term use of glucocorticoid hormones to treat another disorder, the physician will gradually reduce the dose of externally administered steroid to the lowest dose adequate for control of that disorder. Once control is established, the dose of glucocorticoid hormones may be given on alternate days to lessen side effects for the patient. Surgery is the most often done through a transnasal transsphenoidal approach, which will not leave a visible scar. This type of surgery may be performed per the surgeon's preference using either a minimally invasive operating microscope or with the use of an endoscope. In patients to whom a remission is not obtained after surgery, the use of various medications that can inhibit cortisol production may be used, such as ketonazole, nitotane, metirapone, and mifepristone. These agents are not effective as surgery and considered a second-line course of treatment. In some patients who are particularly resistant to all forms of therapy, removal of adrenal glands bilaterally may be considered. One additional treatment option in patients who have failed surgical procedures or are too high risk medically to bring to surgery is radiation therapy. Radiation therapy, which administered over a 6-week period of the pituitary glands, has yielded improvement in 40 to 50% of adults and up to 85% of children. Stereotactic radiosurgery has also been found to be an effective treatment for patients with an ACTH secreting pituitary adenomas. So that's it. Thank you for watching. Thank you.